So antipsychotics are drugs used to treat psychotic disorders like schizophrenia, bipolar disorder, and sometimes severe depression. They work by affecting neurotransmitters, especially dopamine. So in schizophrenia, would have patients complaining of visual hallucination. It has a 40% increased risk in smoking. Patients complain of hearing voices and feel like they're being followed. While in bipolar disorder, we have two phases, which is commonly known as the depression phase and the maniac phase. We're going to talk about the pathway which we see dopamine being overactive in the mesolimbic pathway. So antipsychotic block the D2 receptors, turning the volume down that overreacts the signal. We have the two classifications of antipsychotics, and this is where it gets tricky. The typical antipsychotics, that's the first generation antipsychotics, and the atypical antipsychotics, that's the second generation antipsychotics. The first generation antipsychotics, all the drugs example include haloperidol and chlorpromazine, which are known to treat positive symptoms of like schizophrenia, like hallucination. The side effects are very common and dangerous, especially the extrapyramidal symptoms, where we have patients coming in with acute dystonia and tardive dyskinesia. In severe form, we could have the neuroleptic malignant syndrome. While for atypical antipsychotics, we have drugs like risperidone, olanzapine, quetiapine, and clozapine. Note that this drug treats both positive and negative symptoms, and the side effects include weight gain, diabetes, and most importantly, metabolic syndrome. So, especially with olanzapine and clozapine. Note that clozapine also have a high risk of agranulocytosis, so you should monitor the blood regularly. So we're going to discuss a few side effects, the EPS side effects like acute dystonia, which we have long-lasting contrasting spasm of musculature develops, secondary to the use of antipsychotic medications. Acute dystonia usually subsides spontaneously within hours or after onset. So the common type of dystonias we have include torticollis, which is the lateral neck rotation, retrocollis, which is the neck extension. We also have patients coming in with trismus, that's the forced jaw closing, and tongue protrusion, that's the involuntary protrusion of the tongue. Optitotonus, which is the extension of the head, neck, and prostinal muscles in an arc, or the oculogyratic crisis, which is the forced fuller eye deviation. We also have Parkinsonism symptoms. These symptoms usually occur in patients that have young use of antipsychotic medication. We have characteristics of Parkinsonism, which include the tremors, the Parkinson gait, rigidity, which we usually classify as the cogwheel rigidity or the lead pipe rigidity. We have voice masking, tremors, slow time reaction, and frequent falls. Next is we're going to talk about akathisia. So akathisia is the inability to sit, the subjective feeling of restlessness and an intense unpleasant need to move occurring secondary to antipsychotic treatment. We'd have patients complain of restlessness, fidget movement, swinging of legs, rocking from foot to foot while standing. We'd have pacing to relieve restlessness and inability to sit or stand for several minutes. Next is the tardive dyskinesia, which is a syndrome consisting of abnormal, involuntary, choreatoid movements, typically involving the mouth, face, jaw, trunk, and it's caused by the long-term use of antipsychotic medications. So usually would have the features which include the chloroform movements, which are rapid, jerky, and non-repetitive. We have the attitoid movements, which are slow, sinus, and continual, and the rhythmic movements, which are stereotypes. So for the treatment, we usually avoid the medication or we reduce clozapine or any other antipsychotics that is being given. We also include vitamin E, and we try to assess the whole situation that may improve the treatment. We're quickly going to discuss a case of a patient that comes in with both positive and negative symptoms. Note that positive symptoms are the symptoms that are there but shouldn't be there. Example, hallucination, or the visual auditory delusions, or disorganized speech and thoughts, while negative symptoms are symptoms that should be there but aren't present. Note that negative symptoms include anhedonia, avolition, or blunted effects, not being in the mood, losing interest in pleasurable activities, and more. So in this case, we're going to use atypical antipsychotic to treat this patient because it has good reviews for both positive and negative symptoms and less extrapyramidal side effects, but we have to watch out for metabolic side effects. I'll see you in the next video, but don't forget to please like, share, and subscribe. I'm going to make more videos with more cases and more explanation regarding positive and negative symptoms.